RSV season usually starts in November and goes through April each year, peaking in January and February. And many parents are very concerned about their children when they start to show signs of a cold and want to know, when is it time to go to the doctor, or when should I be concerned? This is a very valid question. There are certain populations that are at greater risk for it. For example, children who are younger than 6 months of age, especially those who were born during RSV season, any babies who were born prematurely, especially before 35 weeks gestation, those who are exposed to secondhand smoke or have other pre-existing conditions like chronic lung infections or heart problems. RSV is spread from person to person if you come into contact with the secretions of a person who's infected. And so the best thing to do is to stay away from sick people if you know that, but that's in an ideal world. Many times we're introduced to things and we didn't even know they existed. So you go to the grocery store and you touch the grocery cart of someone who's been infected, those sorts of things. The best thing to do is to wash your hands. Wash them frequently and teach your children how to wash their hands. Use warm water and soap, and for children, when you're teaching them the proper way, they should usually rub for at least 15 to 20 seconds. And so have them sing happy birthday or the ABCs, and this should usually get them to lather long enough. If you're out and about, carry around an alcohol-based hand sanitizer and use this frequently. And if you or someone in your home is sick, decontaminate frequently touched surfaces in your home. Now, when it comes to common cold, usually it just starts out with a runny nose and a cough and maybe some sneezing. And this is normal as long as your child is happy otherwise, they're sleeping well, they're eating, and the cough isn't severe enough to affect their sleeping habits or their ability to function throughout the day, they're not running a fever, then it's usually okay to just support them through it by using a cool mist vaporizer in their room at night, maybe a steam session before they go to bed. And especially for small children, the most effective thing is probably going to be some saline drops in a bulb syringe. Put 2 to 3 drops of saline in each nostril. Wait a few seconds and suck out all the extra secretions with the bulb syringe. You should take your child to the doctor if they start to run a fever, if they're just not responding to you like they usually do, they're acting more lethargic, wanting to sleep more, if they're not eating like they usually do, if you're worried about them becoming dehydrated, or if the cough becomes more persistent, like it's keeping them up at night or affecting their ability to function during the day. You should take your child to the doctor if their nasal secretions start to become like a greenish, yellowish, grayish color, if the secretions become so thick that they're having a hard time breathing, if they start to run a fever or the cough becomes more persistent or severe, if they're not eating like they usually do, or if you have any suspicions that they're dehydrated. And in a baby, this would mean that they're having less than 6 wet diapers a day. However, if at any time they are having difficulty breathing, they turn blue or pale, or they stop breathing, call 911 and get medical attention immediately. Most kids get about 6 to 9 colds a year, and so it'll seem like after they've had one, they get over it and get another one, and that's usually how it goes during the winter months. And thankfully, most kids just need a little bit of support from home and a little bit of help while they get through it. But every once in a while, it requires hospitalization. So if you have any questions or concerns about your little ones, don't hesitate to ask your doctor. If you have any other questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.